Greetings, I'm Dr. Karl Nath, the Editor-in-Chief of Mayo Clinic Proceedings, and I am pleased to welcome you to the multimedia summary for the journal's November 2021 issue. There are 3 articles that have been selected as our editor's choice or highlights articles this month. The editor's choice this month is a brief report entitled SARS-CoV-2 Testing Before International Airline Travel, December 2020 to May 2021. It is authored by Dr. Aaron Tandy and colleagues from Mayo Clinic in Rochester, Minnesota, and colleagues from Delta Airlines, Emory University School of Medicine, and the Georgia Department of Health, all in Atlanta, Georgia. Travel has the potential of spreading communicable diseases, and this is especially true for airline travel, with its relative proximity of passengers, the confines of the airline cabin, and the speed and efficiency with which travelers are brought into contact with distant communities. Knowing whether a passenger has active SARS-CoV-2 on a commercial airline flight is a critically important issue for both the infected passenger as well as other passengers who would be at risk for acquiring the infection during travel. In the present issue of Mayo Clinic Proceedings, Tandy et al. Evaluated the extent to which SARS-CoV-2 testing within a specific time frame before departure within 72 hours could aid in assessing such risk. These investigators studied passengers on commercial flights between the United States, departing either from JFK, New York City, or ATL, Atlanta, and arriving in Italy, FCO Rome, or MXP Milan. During the study period, December 19, 2020 through May 19, 2021, the average community infection prevalence rate was estimated to be 1.1%. Individuals in this study were required to provide evidence of a negative molecular test for SARS-CoV-2 within 72 hours of their departure and to confirm the absence of symptoms of COVID-19. Passengers then underwent a rapid antigen test and a rapid molecular test if the former were positive. Passengers with a positive molecular test were not allowed to board. In Italy, passengers were once more tested with a rapid antigen test and a rapid molecular test if the former were positive. In their analysis of 9,853 passengers who reported a negative SARS-CoV-2 PCR performed within 72 hours of departure, either from JFK or Atlanta, 4 passengers tested positive by the rapid antigen test and molecular test at these airports, with 1 additional similarly positive passenger detected on arrival in Italy. The significance of this timely study by Tandy and colleagues is at least twofold. First, this logistically challenging study required collaboration among diverse groups, including, among others, Mayo Clinic, Delta Airlines, the Georgia Department of Health, the Centers for Disease Control and Prevention, relevant airports in the United States and Italy, and the Italian government authorities. Second, this novel study demonstrates that a quite low percentage of airline passengers departing on international flights will be identified as having active SARS-CoV-2 infection on a rapid antigen test if within the preceding 72 hours, these passengers had a negative SARS-CoV-2 molecular test. The first highlight article this month is an original article that demonstrates the diagnosis of cardiac amyloidosis by an artificial intelligence AI enhanced ECG. This article is entitled Artificial Intelligence Enhanced Electrocardiogram for Early Detection of Cardiac Amyloidosis. It is authored by Dr. Martha Grogan and colleagues from Mayo Clinic in Rochester, Minnesota. For those diseases in which specific therapies may ameliorate their course and prognosis, It is especially important that their diagnosis be disclosed without delay and preferably as facilely and non-intrusively as possible. The standard electrocardiogram ECG is a relatively simple, straightforward, inexpensive, non-invasive, widely utilized diagnostic tool that is conventionally used in assessing arrhythmias, coronary artery disease, acute coronary syndromes, and ventricular hypertrophy and strain. Grogan et al. Demonstrate how the application of artificial intelligence, AI, can transform the standard ECG into a sensitive modality that may call attention to the presence of underlying cardiac amyloidosis, a disease commonly diagnosed either by a sophisticated imaging approach, such as a technetium pyrophosphate scan, or by an invasive cardiac biopsy. Cardiac amyloidosis is mainly caused by two conditions, namely light chain associated and transthyretin amyloid, the former a relatively rare disease, and the latter a diagnosis that is either missed or delayed, and not as rare a disease as was once thought. Cardiac amyloid caused by either condition is a major determinant of morbidity and mortality. And not only can they both be treated, but improvements in such therapies are steadily evolving. The essential findings of Grogan et al. Include the following. First, the 12-lead ECG can reliably predict cardiac amyloidosis when enhanced by AI, and this is true for either type of cardiac amyloid. Second, when serial ECGs were available for AI enhancement, such prediction of cardiac amyloid may antedate the clinical diagnosis in the majority of cases. And third, point-of-care screening and diagnosis can capitalize on this AI-enhanced ECG innovation because this technological advance can be adapted to single-lead and six-lead data acquisition. As emphasized by Grogan et al., a major challenge that exists with regards to cardiac amyloidosis is that it is insufficiently considered and diagnosed by providers, thereby depriving patients with this disorder the timely institution of therapy that can ameliorate the course of the disease. The importance of this technological advance by Grogan et al. Is manifold, and in particular is its heightening of the awareness and recognition of an underdiagnosed disease such that effective therapies can be expeditiously initiated. Our second highlight this month is a consensus recommendation on myalgic encephalomyelitis chronic fatigue syndrome that is entitled Myalgic Encephalomyelitis Chronic Fatigue Syndrome, Essentials of Diagnosis and Management. It is authored by Dr. Lucinda Bateman from Bateman Horn Center of Excellence, Salt Lake City, Utah, and colleagues from several national clinics and institutions. Myalgic encephalomyelitis chronic fatigue syndrome is a poorly understood, underdiagnosed, quite challenging condition. This article by Bateman et al. Is based on the knowledge, the expertise, and experience of 21 clinicians dedicated to the study of this condition and its management. This article is timely not only because of the relative high prevalence of this condition and the burden it imposes on those so afflicted, but also because of the following considerations. First, new evidence-based diagnostic criteria have been formulated by the National Academy of Medicine and espoused by the Centers for Disease Control and Prevention. Second, management of myalgic encephalomyelitis chronic fatigue syndrome is evolving as the understanding of this condition increases, as for example, management approaches such as graded exercise and cognitive behavioral therapy are no longer recommended by the CDC and other agencies. And third, in the current COVID pandemic, characteristics of this condition are mimicked by the post-COVID-19 syndrome. Bateman et al. Discuss epidemiology, adverse effects and outcomes in this condition, current diagnostic criteria, and pathophysiology. The latter includes the functional significance and involvement of post-exertional malaise, unrefreshing sleep, cognitive impairment, neurologic abnormalities, autonomic dysfunction, altered immunity, and infectious processes. Key aspects of the history and physical examination are covered, followed by recommended diagnostic tests. Management critically involves such essential strategies as validating the patient's symptoms and condition, assessing and supporting patient needs, educating the patient on the importance of pacing, appropriately addressing and treating symptoms, and where relevant, comorbidities, maintaining regular patient follow-up, and discussing short and long-term prognosis. Importantly, the authors also discuss key conditions to be considered in the differential diagnosis, as well as management approaches that were once recommended but are no longer advised. This invaluable synopsis of myalgic encephalomyelitis, chronic fatigue syndrome, distills essential considerations in the diagnosis and management of this condition and will promote recognition of this relatively common disorder. You can access these highlights and editor's choice articles free of charge during the entire month of November. Please visit our Mayo Clinic Proceedings website at www.mayoclinicproceedings.org. There you'll find links to our social media by clicking the buttons at the top of the home page and at the bottom of any page to follow us on Facebook, Twitter, and YouTube. On our YouTube channel, you'll find full-length author interviews called Insights, 60 seconds video article synopses, and our Mayo Clinic Proceedings issue summary and author insight podcast recordings, which are available from our website on the homepage as well as through iTunes. You will also find our online-only feature, Pioneers and Legends in Medicine, which are video interviews of people who've made a strong impact in their field of study. You will find many news stories posted in News from the Editor carousel on our website homepage that are based on articles published in Mayo Clinic Proceedings. And finally, you will see other free content such as our Path to Patient image quiz, medical images, stamp vignettes on medical science, and Art of Mayo Clinic features, as well as articles published online in press. As always, we greatly thank you for your interest in and your support of Mayo Clinic Proceedings. We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.